In order to become a bariatric surgeon, you need to have baseline credentials. I went to osteopathic school in the state of New Jersey, graduated from my osteopathic school, and did an MD residency at Morristown Memorial Hospital for 5 years. I was a chief resident as my 5th year. After that, I went into practice, and I gained a tremendous amount of experience during the course of my residency doing laparoscopy and doing all types of surgery. When I left my residency, I joined a multi-specialty surgical practice. We did chest surgery, vascular surgery, oncologic cancer surgery, general surgery of all types, and we're extremely busy. For 5 years, I worked very, very hard in that practice and learned a tremendous amount about multiple operations. My skills were laparoscopic, and I began to look at operations as an opportunity to perform them through smaller holes, and turned more and more of my practice towards laparoscopy. When I began to take on laparoscopic bariatric surgery, I became very busy very quickly because there were not people with the skills to be able to do laparoscopic bariatric surgery. I have at this point done more bariatric surgery than many of the people who've written chapters and books on bariatric surgery in a relatively short time because I've been very, very busy and very, very efficient in my ability to do these procedures. Many people spent their entire surgical career and did between 2,000 and 3,000 procedures. Sitting here now, I've done over 7,000 procedures associated with bariatric surgery. I do have gray hair, but I'm not that old. The procedures have modified also as time has gone by, and I've been trained to do gastric band. I was involved in the FDA trials when the band was initially brought into the United States. I was involved in several research projects associated with gastric band and defining just where it was the appropriate surgery and where it was not. I've been involved with gastric balloon surgery to see if it's appropriate for weight loss and just what type of weight loss it's effective for. I've been involved in the evolution of gastric sleeve surgery, in the care of patients associated with centers of excellence, and the establishment of programs for care for patients in multiple different hospitals. I've been involved in the local medical society since the time of my completion of my residency, and I've also been involved in the National American Society for Metabolic and Bariatric Surgery on the Patient Safety Committee for the past 3 years. Bariatric surgeons across the country are a relatively small group. Most of the people around my age are now people who are very, very well thought of at different points of the compass around the United States. It's a small community, it's a small group. When I have an issue or I have a question, I can pick up a phone and I can access any number of different people who are major people at big institutions. And that becomes a huge asset.